Okay, stand up please. Stand up please. Okay, so this is for step 1. We're going to be doing the posture distortion. So I'm going to be seated. I'm going to have my patient walk slightly out in front of me. I'm going to hold my thumb up to his acromion, and I'm going to look forward, look straight ahead. And I'm going to be looking for A to P sway greater than 1/4 of an inch. And if it exists, then it could be indicative of a category 1. Okay, so for the next one, the doctor's also going to be seated. I'm going to have the patient sit in front of me just like this. I'm going to have my thumb at the level of, let's do it a little bit. I'm going to have my thumb at the level of about S2. And I'm looking for any lateral sway greater than 1/4 of an inch. Look straight ahead, buddy. If you see this to one side, then it's a positive for that side. And then it could be indicative of a category 2. Okay, so the last thing that we're going to evaluate for the posture distortion is for possible category 3. We're going to be checking out if they have any antalgic lean. So if I'm going to have my patient just stand here, stand up straight, and we're going to look to see if he's leaning to one side or the other. Look straight ahead, Bubba. There you go. And he does not appear to be having this, but if he did, it would be more indicative of a category 3. Okay, so for this one, step 2, we're going to be palpating the patient's ribs. So I'm going to put my thumbs on the T1 tubercle and then palpate the ribs up here. I'm going to have the patient fully flex and extend their head. Go down, Gunner. And back up. Go down. Back up. All the way back. All the way back. There you go, buddy. Okay, great job. So the degree of the pain of tenderness on each side is usually going to be related to the amount of the extent of the injury. And then the side of the pain of the most tenderness is going to be the side of the SI joint lesion. Okay, so step 3 is the cervical palpation. So we're going to go down and we're going to feel each TVP in the cervical spine, as well as all the spinous processes. And we're going to be feeling, asking our patient if any of these feels tender. So if there's tender spinuses, it relates to a lumbar TVP inferiorly, and the tender TVP would relate to a lumbar rotation. So, and that would be considered a category 3 if any of those came up. So. Okay, so for step 4, part 1, this is going to be the cervical compaction test. I'm going to have my patient lay with his legs on the table, flat down. Put this down, hands on your stomach, like this. Now put your legs together, Gunner. Put your legs together, hands on your stomach. Now I'm going to compact your cervicals. Well, first I'm just going to have you raise your legs up. Let me see you raise your legs up. Great job. Put it back down. And now I'm going to do the cervical compaction test. I'll try to raise your legs up now. Okay, whoa, that was easier that time? No, it was harder? It was harder. Okay, so if it's easier for the patient to raise their legs while I'm doing the cervical compaction test, this indicates that there could be a cervical subluxation that needs correction. Okay, so this is part 2 of step 4, and I'm going to have my thenars on my patient's sagittal suture. I'm going to lift your head up like this. And I'm going to apply a P to A pressure. We're going to stair step 4 times. So 1, 2, 3, 4. And come back down. And I'm going to be feeling for any restrictions. These restrictions, depending on which step they were in, will correlate with certain cervical vertebrae. So step 1 restriction would be T1, C7. Step 2 would be C6 and C5. Step 3 would be C4 and C3. And okay, so step 5 is going to correlate with basic 3. We're going to be feeling for any nodules or bumps on the patient's sagittal suture around here. We're going to place our fingertips on the parietal bone, cross our thumbs, and lift. for 3 inhalations or 3 expirations for just 3 total breaths, and lifting on inhalation and letting down on expiration. Okay, so step 5 also consists of basic 1. So we're going to do this prior to the other category 1 procedures, and we're going to place 4 fingers on each side, lateral to the EOP and inferior to the superior nuchal line. We're going to wait till we feel these even out. There's going to be pulsating. We're going to have the patient relax and breathe until the pulsations even out to help with the CSF flow. Okay, so this is for step 6, and this is the psoas correction. So we would stay on the opposite side of the shorthand test. We're going to reach over here. So excuse me, let's open up your ankle a little bit. I'm going to reach around. I'm going to guard her ilium, and I'm going to press into her psoas with my fingertips. I'm going to have the patient breathe in and out. Then I'm going to dig a little deeper, and then repeat that until it releases for step 6. Okay, there now. Okay, so this is step 7. We're going to be assessing to see the rotation of her legs. So we're going to grab her by the ankles, and the side that does not internally rotate as much is going to be the side that we're going to correct. On this case, we're going to pretend like it's her left leg. So we're going to stay on the opposite side. I'm going to place my hand just right by her femur head, and we're going to stand like this, and we're going to, on the count of 3, I'm going to bring it inwards. 1, 2, 3, that. There you go, for correction. Okay, so this is the arm fossa test. I'm gonna have the patient uncross her legs, hands at your side. She's the artifact. We're gonna have her arm up, soft fist facing midline. We're gonna hold this. We're gonna touch the inguinal ligament in 2 different places on each side. So we're gonna do the first, which is gonna be the upper. So let's see, inguinal ligament. Now we're gonna hold. We're gonna do the lower one. Hold, cross, hold, and then whichever one was the weakest would be the primary concern.
My first one was.
Okay, so for the last step, step 8, I would switch sides. I would stay on the side that we're testing, and then I would also specify with words hold, touch with my fingertips, and then pull, and this would be indicative of category 2.